So having said that, really let's jump on to what exactly is PCOS. I mean, what do we really understand by the term PCOS? And it's polycystic ovarian syndrome. It's an endocrine disorder.
Ma'am,
So
sorry to interrupt in between the presentation, the
yes,
share screen is got.
yes, I've just unshared it just so that I can explain this a little better, and then of course, go on to the slides again. So uh, polycystic ovarian syndrome is an endocrine disorder common among women, of course, and it's common when in the reproductive age, leading to reproductive, hormonal, as well as metabolic complications. And in a normal reproductive cycle, when a mature egg is released from an ovary, ovulation occurs so that that egg can get fertilized by a male sperm. However, in cases when women can't make enough of those hormones needed for ovulation, the ovaries actually start developing these small cysts. These cysts may make excess androgens, the male sex hormones that are usually present in women in small amounts. And that's when women with uh, that's how PCOS really occurs. But women with PCOS often have high levels of androgens. That's why, and this can cause more problems with women's menstrual cycle, weight, quality of life, infertility, so many things. And hormonal imbalances don't include just the reproductive hormones, but also hormones that regulate blood sugar, fat storage, and appetite. So, what are then the could be the causes for PCOS? Really, the actual cause of the syndrome is not certain. PCOS seems to be occurring maybe due to, as we all know, we are the phenotype, which is the genotype, that is the genes, plus the environment and food habits and our lifestyle. So, we really are a combination of this, and a complex interaction between this could be causing PCOS. And, that's why this is such an endocrine lifestyle disease. And the personalized nutrition and fitness regimens, lifestyle management, that's why plays a inevitable key role in PCOS prevention and treatment. Integrating the same with medical treatment and lifestyle modifications can be the most effective therapeutic strategy in women suffering with PCOS. Um, so let's further get on to what are the symptoms of PCOS, and the symptoms could be painful, irregular periods, discomfort in the pelvic area, of course, difficulty in getting pregnant, acne, oily skin, abnormal hair growth, increased appetite, weight gain, especially around the belly, and difficulty in losing weight. So these are the symptoms, but if we hear into the possible complications of PCOS, the leading cause it's a leading cause of course, infertility, miscarriage or premature birth, the gestational diabetes or pregnancy-induced high blood pressure. So look at it, where all it can have an impact. And a pregnancy can be so very difficult with PCOS, though it's not impossible. And obesity and insulin resistance, which will eventually lead to type 2 diabetes. Almost 50% of women with PCOS actually get type 2 diabetes. So you can look at it. So, the next generation can get it. The next generation can then further get type 2 diabetes. So, the population of people suffering from endocrine diseases and metabolic disorders is only going to grow, because woman is, and her womb is where the next generation is actually getting nurtured. So we really, really need to watch this disease for really the next generation. The metabolic syndrome is twice as common. That's why causing high blood pressure, high sugar, high cholesterol, or triglyceride levels, which can increase the risk of heart disease and stroke. Abnormal uterine bleeding can occur. Cancer of the uterine lining also becomes common. The endometrial cancer, which we know as, and then the depression, anxiety, and eating disorders. So so many and more to add to it. Overweight women may also develop sleep apnea, a condition that causes interrupted breathing during sleep. So, non-alcoholic steatohepatitis, severe liver inflammation caused by fat accumulation in liver is also the possibility of getting that is also there. So, you can look at, yeah, we just know it as PCOS, but remember it's a syndrome. So it has to be managed. It can uh, it can be managed and it can be less, more, come and go, but it's something which has to be really looked at, and which is why it is very important for women to eat well. And women really don't eat well. Now, of course, the teenagers are eating a lot of junk food, but also after women conceive and they have children, even then they don't eat well. Their whole role is to feed the family, and they do not look after their own nutrition, fitness, exercise, and lifestyle. So, it's extremely important that this awareness needs to be created amongst the young women today. Then how do you really diagnose PCOS? There is no test definitively to diagnose PCOS, but a physical examination of excess hair growth, insulin resistance, weight gain, acne, menstrual periods, pelvic examination of reproductive organs for masses growths or other abnormalities can be done, and blood tests to measure hormone levels, blood sugar levels, lipid levels, and of course these tests, once women are suspected to have PCOS, this along with the screening of the thyroid disease, the hyperprolactinemia, and the non-classical congenital adrenal hyperplasia, this has to actually be done. So, these tests, additionally to the fact that we are trying to investigate a PCOS, has to be done to see if there are other um, the other lifestyle diseases that are there along with it. And invariably, we see so many patients having thyroid along with PCOS, having, of course, obesity, but even other times, infertility is very common. But along with it, women have hypertension. Women have so many other lifestyle issues along with it going. So, very tricky. And that's why a good screening, especially because we don't have a definitive diagnostics here, this has to be done. And of course, the ultrasound, which is pivotal, very important to check the appearance of the ovaries and the thickness of the lining of the uterus. All this can actually be a way to diagnose PCOS. And very intelligent gynecologists, and the way women in gynecology are into academics today, and the amount of research that's going on, the gynecologists are very, very smart to detect a PCOS these days than it was earlier. So that's good news. So at least we are able to detect PCOS, plus we are also able to detect PCOS a little early. The earlier we detect it, the better it is. However, in case of younger teenagers, we need to actually let them be for a couple of years. We have to keep monitoring them if these kind of symptoms are occurring. Now we move on to the different PCOS treatments that are available, and the treatment of polycystic ovarian syndrome is very individualized based on the patient's presentation and desire for pregnancy is one thing. What presentation in terms of what are the different tests and what are the different diseases they are coming along with it, how uh, grave is the issue, all that has to be studied, and accordingly an individualized treatment plan has to be made. There are a variety of therapeutic approaches that are available, and also initially lifestyle changes are suggested, including more exercise and proper nutrition, and honestly using nutrition instead of just dieting. And I'll explain that why in just a bit. These changes not only lead to weight loss, but reduce insulin resistance, lower incidence of type 2 diabetes, and reduced hyperandrogenism. But this also enhances women fertility and menstruation is restored. So, all these gains are there by making small lifestyle to big lifestyle changes, and of course, using nutrition to actually manage the disease much, much better. The therapeutic role of individual foods and nutrients is very significant in helping reduce the inflammatory condition that paves the way for insulin resistance, really. So let me again share my slides now, because now that we talk more specific about nutrition, well, we all know, most of us now these days know that, when there's PCOS, we start watching for weight, for if there is obesity, if the women are overweight. And what really happens is the hormonal factors in PCOS actually induce a weight gain, and the weight gain in turn also induces PCOS, making this whole thing a very difficult cycle of events. So we see there's decreased metabolic rate, increased insulin resistance, increased cortisol levels, and decreased progesterone. All this can lead to multiple different complications, further complications. And in PCOS, losing weight has shown to reverse insulin resistance, lower their androgen levels, lower inflammation, improve the mood, improve energy levels as well.